Hi friends, welcome back to my channel. This is your Julie and I am here with a new video. So if you are new to my channel, kindly like, share and subscribe. So guys, I guess everybody is in a mood to study today. So let's learn a disease condition. Today I am going to deal with myocardial infarction. So as everybody knows, myocardial infarction in layman's language also called as heart attack. So what is myocardial infarction? So the definition goes like this. Myocardial infarction is an irreversible damage to the myocardial cells due to decreased blood flow to the coronary arteries due to atherosclerosis. So what is this atherosclerosis? Atherosclerosis also called as plaque formation. So guys, our heart lumen or the coronary artery, it's like a tubule, and if something gets blocked into it, the oxygen supply is cut off, and which causes complete necrosis of the tissue. So that's the definition of myocardial infarction. So now what are the risk factors? Who are at risk? So the risk factors include old age, the people who have family history, obesity, the people with high cholesterol levels and also with high blood pressure. So these people are very prone to myocardial infarction. So guess till now everybody is with me. So now we will move on to what are the etiological factors of myocardial infarction. So the etiological factors include sudden constriction or narrowing of the coronary artery. So this can be because of multiple reasons, like I explained before. The atherosclerosis causes the narrowing of our lumen of the coronary artery. The next one is decreased oxygen supply to the heart. So this can also be because of multiple reasons, maybe because of any disease condition or because of trauma, because of hemorrhage. This can be a reason. The next one is increased demand for oxygen by increased heart rate. So in such condition, this can be because of some medications. If someone is consuming some medication which causes increased heart rate, the heart has to pump more, so which will lead to more demand for the oxygen, and this can also be a reason for myocardial infarction. So what are the clinical manifestations of myocardial infarction? So the clinical manifestation include diaphoresis, also called as sweating, cold clammy skin, hypotension or hypertension. The patient may experience hypotension or hypertension, bradycardia or tachycardia, premature ventricular or atrial beats, dyspnea, nausea or vomiting in some cases, and also confusion. So these are the clinical manifestation of myocardial infarction. What is the treatment? So treatment goes like this. The first drug of choice for myocardial infarction is morphine, then goes oxygen therapy, then we also treat with thrombolytic agents, anxiolytic agents, thrombolytics, anxiolytics, beta blockers and calcium channel blockers. So guys, I repeat, the treatment part is very important. First drug of choice is morphine. We also treat with, so drugs we can just remember: morphine, nitroglycerin, calcium channel blockers. We also give anxiolytics, nitroglycerin I already told. So these are the things which we cover as medication part. Other than that, oxygen therapy is administered. So this is the treatment. And we also go for surgical interventions, that is CABG or stenting or whatever according to what the physician says. So now let's move on to the most important role, that's our role, that is nursing roles and responsibility. What is nursing roles and responsibility? So guys, you know that the heart is already tired, and what we can provide is bed rest. So first and foremost is bed rest. We need to give very less workload to the heart. So bed rest reduces myocardial oxygen consumption. Second is ECG monitoring. We need to monitor ECG on a regular basis. That's why we are calling it as a serial ECG or a serial TROP-T, which is done in myocardial infarction patients. This is to rule out whether there is any new atrial or ventricular fibrillation, or whether there is any new changes in our heart. Then you have to keep all this ECGs in the patient's file so that the physician can rule out whether there is any new changes. Next is emotional support. So friends, I already told you that in this myocardial infarction, it's a variant disease with hypotension, with bradycardia, with tachycardia. The patient will experience multiple things. So like the patient is not emotionally happy with what he or she is undergoing. So as a nurse, our role is to give psychological support to the patient, explain to the patient before you do any of the procedure. Then you can give stool softness. This will reduce the straining of during defecation. So this will reduce the workload to the heart. Next comes cardiac rehabilitation. So in cardiac rehabilitation, you can explain or give education regarding what are the what has to be done, their diet, their exercise, everything. But this comes in the later part. Then we also have to give the anti-embolic stockings to the patients. So this is to prevent further thrombus formation. So this is all our nursing roles and responsibilities. So I hope this video was very informative for every one of you. So keep following me, kindly like, subscribe, and hit that bell icon if you like my channel. Thank you.